picture this. You've got a big meeting, huge presentation. This could make your career. And then, bam, you have this throbbing, banging pain in your head. The lights, the fluorescent lights feels like daggers. You've tried painkillers, but you don't even touch the pain. Treatment for migraine is not a one-size-fits-all, but there is hope. While there is no cure for migraine, there are treatments that can help. Now, as a healthcare professional, a pharmacist for that matter, that follows the NICE guidelines and various protocols, the NICE guidelines says you go with the acute treatment plan, and then you move on to the preventative, and then just a little short sentence for non-pharmacological treatment, so non-medication treatment. I prefer to do things the other way around. I still follow the guidelines, but what I do is start with non-pharmacological treatment. I know that right now you're having this throbbing pain. If you have not tried the following, then we'll move to acute phase. So have you tried? Now, if this is your first time, this is what I'm talking about. If it's your first time, if you're a pro in having migraine attack, then you know that you've passed this phase. But for first time, or if you're a first time experiencing this throbbing pain, this light feeling like daggers, one thing that you do is, first thing I normally think of is, am I deficient in some form of nutrient? And many times, people that are living with migraine or experience what they classify as really bad headache can be a nutrient deficiency, and that can be magnesium deficiency or a vitamin deficiency. For example, vitamin B2 riboflavin might be deficient in that, or magnesium. And so you look to take magnesium supplements because maybe your diet is not rich in magnesium-rich foods. And we'll talk about that in a later episode. You can also use compress to put to your head to relieve the pain. Close your eyes if you're having that banging, stabbing sensation in your eyes. Close your eyes, put cold compress both eyes, and then see how that feels. Another thing is looking at your lifestyle modification is really key. Look at your sleep routine. We start to implement good sleep hygiene. Note when you go to bed, what type of sleep you have. If you're waking up in the middle of the night, if things are still rolling in your head and you cannot sleep, we look at that. Are you hypersensitive before you go to bed and finding it difficult to completely fall asleep? We look at that. We look at your diet. What are you eating? Are you eating any processed food? Eliminating that from your diet, especially gluten. Some people are sensitive to gluten, wheat, and dairy. Look at removing that, excluding those from your food. Some people use heat to relieve their pain, or like I mentioned, cold compress to relieve their pain. So some of them might go and have a shower or even have a hot bath. It all depends. And this is when you start to track and see what it is that works for you. And that is why having a migraine diary or a headache diary is really important, and it does help. It helps you keep track of your triggers, note the patterns, note what is going on, and note down the life changes that have occurred in your life. This non-pharmacological, non-medication step helps, especially if you're somebody that doesn't like taking pills or doesn't want to bombard themselves with synthetic chemicals, for example, or is trying to reducing the amount of chemicals that they ingest and put in their body. If you're into taking supplements, find a good source, a good supplier of these supplements. Look at having magnesium in your migraine health kit, magnesium, vitamin D, riboflavin, which is vitamin B, and CoQ10. Have those in your toolkit. Then look at your sleep patterns and down your triggers and the patterns that you observe. Now, following the guidelines, when you're having throbbing pain and you want to take pharmacological treatments, start off with the acute treatments. Acute treatments include things like paracetamol, ibuprofen. You take those. And the paracetamol as recommended. With ibuprofen, make sure you have on a full stomach because you don't want to get stomach problems. There are other acute medication that you can add on, like, for example, sumatriptan is commonly used. And then you have slightly newer products, the G-pants, that are also used in acute treatments. When you're taking pharmacological treatment, especially in the acute treatment, most of this medication can cause another type of migraine, which is classified as a secondary type of headache. And this is medication overuse headaches. And medication overuse headaches tend to happen when you're taking so much of these painkillers, triptans. They can cause medication overuse headache. Medication overuse headaches, or sometimes it's also called rebound headaches, they tend to happen when you have been taking these pain medications. So it could be maybe you're taking a lot of paracetamol or a lot of triptans. You're taking them way too often for a long period of time. You can get medication headache. A patient came to me and showed me image of a medication that the practice nurse had prescribed for her. And she had come in because she felt that she had migraine. And the practice nurse gave her cocodamol, contains codeine and paracetamol. Codeine is an opioid and it is a big fat no for migraine. And imagine taking that every single time that you feel like you've got a migraine attack. You're basically gradually pouring more and more fuel onto the headache, because guess what? The headache is going to become much more severe. Anything that is opioid is not good for migraine, for headache. It's not. No matter the strength. The practice nurse first gave her 8 by 500 and then upped it to 15 by 500. Cocoa is not the best medication for you to take for migraine. It causes you to have a much more severe headache. And also, medication overuse headache is just the worst. Ask me how I know. Once upon a time, I was diagnosed with migraine, and I've had migraines since I was a child, and I didn't know I had migraine. I called them brain headache until I was grown up in my 30s, that I finally got diagnosed as having migraine. And the episode that led to that was that I had medication overuse headaches. That was one of the diagnoses apart from the migraine. So a secondary headache. And that was because I was on a lot of opioids. Let's put it this way. I had medication overuse headaches, and this stemmed from taking opioids. If you have another underlying health issues, which I have, and I have chronic pain, you have chronic pain, and you have to take pain medication, especially strong opioids, there is a chance that if you have headache, apart from the chronic pain you're suffering from, if you manage to have headache and you carry on taking the opioid, the headache can graduate to medication overuse headache. And that is because of the opioids you're taking. So things like codeine, morphine, dihydrocodeine, stuff like that can cause you to have medication overuse headaches. So in the acute treatment phase, we're advised, the guidelines says, take paracetamol, ibuprofen, aspirin, tryptophan, and G-pants. You can have those. But be careful how you take them. You must take them the way they have been prescribed to you. Now, the second phase, once you are now taking these acute medication and it doesn't seem to work, there's a time frame that you're allowed to take this medication. And once that time frame elapses, you're supposed to now step up to the preventative phase of treatment. Most people don't. They still remain on the acute phase, and that is very risky, and that can also cause you to have medication overuse headache. So what are the types of preventatives that you can use during your migraine attack? I'm glad you asked. Before we get to the preventative treatments for you to take, we need to, first of all, talk about why you might have to step up to these form of treatments. Preventative medication, you step up to them when, for example, your migraine attack is much more frequent. So if you're having 4 or more days with migraine attack in a month, then you might need to start being on preventative. You may have to graduate to take a preventative if the migraine attack is really, really disabling to you, to your work life, to your whole life. Then you might have to graduate to taking the preventatives. You might need to be on preventative if the acute medication that you have been on, they are no longer working, especially if you are taking them at the maximum allowable amount and you're still having attacks, you're still having the pain, then you might have to step up to the preventative. If, for example, you're taking this acute medication for more than 2 in a week at the highest strength, then you might have to graduate to preventative. Now, before you are placed on these preventative medication, there are different types of preventative, and before you're placed on one of them, we have to do an assessment to find out which one is much more suitable for you. So, for example, looking at, do you have any other underlying health condition? Are you, for example, dealing with anxiety or stress? Are you living with another form of health condition? Do you have history of heart attack or hypertension? Are you someone that is living with epilepsy or any type of other health condition. We have to assess that. Are you allergic to anything? Do you experience any type of side effects when you take certain medication? Is there any other medication that you're taking? Because the thing is, we don't want to give you a medication that interacts with the preventative. We don't want you to take a preventative that interacts with your medication. Also, if you're a woman, also check to make sure that you're not pregnant, because there are certain medication that you cannot take if you're pregnant or if you're even trying to conceive. Now, in taking the preventative, there are certain steps you have to follow. So, for every preventative that you're taking, you start with a low dose and then we increase the dose step by step. So, we start low and we go slow to the increased allowable dosage. We do this because we want to monitor you and make sure that there are no side effects and that the medication is actually working and really benefiting you. This is how we gradually graduate you through the preventative treatment phase. Also, one particular aspect that not many people follow and which is part of the guidelines and you need to follow is that the preventative needs to be reassessed after 12 weeks of being on that medication. It can take up to 8 weeks for us to see some form of improvement and get a good understanding of if the medication is working properly or not, or if we need to make some adjustments. Ideally, though, you need to be on a preventative for at least 12 weeks because we want to see that you have actually followed this whole step before you get referred to a specialist. So there is a whole 12-week window that will walk through and make sure that the preventative is really doing its job. Now, if you're on a particular dosage and the medication is not working, the preventative is not working, it's not doing its job, we can assess you and then step up the dosage. If we've reached the maximum dosage for that particular person and still it hasn't helped, then we'll assess you and put you on a different type of preventative. And then we do the process again. Many times we might even recommend a combination treatment. So you have 2 medications that you're taking that are preventative to see if that will help with your migraine. This step has to be followed before you can be referred to a specialist neurologist. They want to see that we've done all we can and then we've tried everything that we can. And if everything has not been successful, then you're referred to a neurologist. There are also other reasons why you might be referred to a neurologist a lot sooner, and we'll talk about that in another episode. So now, what are the types of preventative? I'm just going to share with you, give you some examples of the type of preventatives that are currently out there. So the first type, this is in no particular order, it's just examples. So you have the ACE inhibitors. So these are things like lisinopril, you have the candesartan. These are tablets that you can take every day. Then you have the ones that are anticonvulsants or anti-epileptic medication. And these are examples like topiramate, sodium valproate. You have you have to take this every day as well. You can take either the tablet form or the liquid form. And this particular medication, there's restricted use in women, especially women that are pregnant or of childbearing age. If you are trying to conceive, or if you're pregnant, or if you're in the childbearing age, then this medication might not be suitable for you. Then there are the beta blockers. The beta blockers are things like propranolol, timolol, different types of them, and you can take these every day as well. Then the Botox injections, you take them every 3 months, and this is actually only for chronic migraines. If you have more than 15 migraine in a month, then you'll be eligible to have this injected to your muscles. And it's normally every 3 months. The next one is the CGRP monoclonal antibodies. These fairly new to the market. It's an injection under the skin monthly, or sometimes you can go and have an infusion every 3 months. Then there are the calcium channel blockers that you can also tablets. Then I mentioned the G-pants. You can have them orally, so by mouth, every day or every other day. There is a greater occipital nerve blockers injections that you can also try. This is an injection that is given every 3 months. There the serotonin antagonist, and that is something that you can also orally. So you can have that, take that by mouth as a tablet. It's called Dotifan. And then there is the cyclic antidepressants. Example, which I'm sure you've heard before, is the triptyline. And this also you can have orally by mouth. You can have that daily as well. So those are the types of preventatives. And you can see before you're given these medication or prescribe this medication, you have to have a conversation with your healthcare professional or your GP to make sure that it is suitable for you and it is the right one for you. Non-pharmacological treatments tends to be placed as the bottom for any treatment in general for any condition. But I am an advocate for someone that encourages you to try non-pharmacological treatment first before going to the pharmacological treatment. And just because it is a non-pharmacological treatment doesn't mean that it has no side effects. Okay? Or everything has side effects. Even the food that you eat has side effects. So it is all based on how your body processes and if it is good for you, really. So making sure that are taking the right supplements from the right company, the right provider, and not because most supplements or medication really, the way it is made, there are certain things that are put in them. Some companies use more of those chemicals than others. So you have to be very careful about what type of supplements you get from. Be careful where you get your supplements from, and also aim to be aware of what is in your supplements, because not all supplements are created the same, like I'm sure you know already. Other types of non-pharmacological treatment could be acupuncture. Having massages can also help, especially if you find that you get stiffness of the neck and the back area. You can go for a massage treatment and see if that can help. Some medical devices that you can put to your forehead Some people use them as well. There are many non-pharmacological treatments out there. Behavioral change is one way to really reduce the amount of migraine attacks, the amount of headaches that you are getting. But the most important thing is work with your healthcare provider to design a personalized plan for you. Your personalized plan could look like one medication or strategy for stopping an attack, or even adding on another strategy for preventing an attack. Always keep track of any side effects. Always keep track of any unusual changes. Your healthcare provider know about all this, because the goal is to help you achieve migraine relief. Treatment is a journey. It will take time. Some preventative can take up to 8 weeks for you to start to see the difference, especially things like amitriptyline, for example. They can take a while for you to see improvements. Even propranolol can take some time. So patience is the game. Having patience. With the right plan, you can achieve migraine relief. You can gain control of the migraine and not the other way around, not migraine controlling your life. Thank you for watching. In the description, we've got the resource kit, which contains trackers, contains more information to help you on your journey to achieving migraine relief. So until next time, I'm wishing you ongoing success. So you take care. Bye.